Hello everyone, my name is Christoto Asamoah, and this presentation compares the healthcare system of the United States and Ghana. The goal of this project is to explore differences in healthcare structures, outcomes, and access, and to identify aspects of Ghanaia's healthcare system that could be adopted in the United States to reduce costs whilst improving health outcomes. So for the introduction, the United States spends more per capita on healthcare than any other industrialized nation, yet it continues to experience poorer health outcomes and significant health disparities. Comparing the US system to Ghanaians, an emerging healthcare system with universal coverage provides insight into how access, efficiency, and equity can be improved through different policy approaches. Why compare these healthcare systems? Although Ghana and the United States differ greatly in income levels and resources, their healthcare systems reveal important contrasts. Ghana has prioritized access and primary care through public programs, while the US rely heavily on private insurance. Evaluating these differences help identify strategies that promote equity and cost efficiency in healthcare delivery. Demographic overview. Ghana has a population of approximately 33 million people, with over 100 ethnic groups, including Akan, Mole Dagbani, Ewe. English is the official language, alongside more than 80 local languages. About 56% of the population lives in urban areas, whilst a significant portion remain in rural communities, which influences healthcare access and delivery. Life expectancy and population characteristics in Ghana. Life expectancy in Ghana has steadily improved due to the expanded access to primary healthcare and public health interventions. However, disparities remain between urban and rural populations, particularly in access to specialized care and healthcare infrastructures. Mortality and morbidity in Ghana. Ghana continues to face challenges related to maternal and infant mortality. Infant mortality rates remain around 28 to 29 deaths per thousand lives birth, while maternal mortality is approximately 234 per 100,000 births. Communicable diseases such as malaria, tuberculosis, and HIV/AIDS remain common, whilst non-communicable diseases like diabetes and hypertension are increasing. Common causes of death in Ghana. The leading causes of death in Ghana include infectious diseases, maternal causes, and complications related to preventable conditions. As lifestyle changes, cardiovascular disease and other chronic conditions are becoming more prominent contributors to mortality. Most treated illnesses in Ghana. Healthcare facilities in Ghana most frequently treat malaria, respiratory infection, maternal-related conditions, and childhood illnesses. Chronic conditions such as hypertension and diabetes are also increasingly treated, reflecting on ongoing epidemiological transition. Structure of Ghanaian's healthcare system. Ghanaian's healthcare system follows a mixed model consisting of public, private, and faith-based providers. The Ministry of Health sets national policies, while the Ghana Health Service oversees service delivery. Healthcare is organized across multiple levels, ranging from community-based CHPS compounds to district, regional, and national hospitals. Ghana National Health Insurance Scheme (NHIS). The National Health Insurance Scheme was established in 2003 to promote equitable access to healthcare and reduce financial barriers. It is funded through value-added tax revenue, payroll deduction, government support, and member premium. Vulnerable population, including children, pregnant women, and the elderly, are exempt from premium. What NHIS covers. NHIS cover a wide range of services, including outpatient care, hospital admission, maternity services, and essential medications, Although not all services are covered, the program significantly reduced out-of-pocket costs for most Ghanaians. U.S. healthcare system overview. The U.S. healthcare system is highly fragmented, consisting of private insurance, employee-based coverage, and public programs such as Medicare and Medicaid. Unlike Ghanaian system, access to care in the United States is largely determined by insurance status rather than universal eligibility. Key health challenges in the United States. The United States faces a high burden of chronic diseases, including heart disease, cancer, and diabetes. Healthcare costs, particularly for prescriptive drugs and hospital services, are extremely high. Despite these expenditures, millions of Americans remain uninsured or underinsured, and racial and socioeconomic disparities persist. Comparing healthcare system structures. Ghanaian system emphasize universal coverage and primary care, especially through community-based CHPS programs that improve rural access. In contrast, the US system is profit-driven, costly, and fragmented, leading to unequal access depending on the employment and insurance coverage. Comparing health outcomes. Ghana experiences higher maternal and infant mortality and a heavier burden of infectious diseases. The United States has lower rate of infectious disease but struggle with higher rate of chronic disease. Despite higher spending, US outcomes do not consistently outperform those of countries with universal coverage. Strength of Ghana healthcare system. Strength of Ghana healthcare system include its universal insurance framework focused on primary and preventive care and community outreach through CHPS. These approaches promote early intervention and improve health access to underserved population. Strengths of the U.S. system. The U.S. healthcare system excels in advanced medical technology, specialized care, and research innovation. Patients often have access to cutting-edge treatments. However, these benefits are not equitably distributed across the population. Weaknesses in both systems. Both systems face challenges. Ghana struggles with limited specialized care and funding sustainability, particularly in rural areas. The United States faces excessive costs, administrative complexity, and unequal access to healthcare services. What the US can adapt from Ghana. The United States could adapt several strategies from Ghana, including expanding community-based primary care programs, simplifying insurance structures, and prioritizing prevention services. These changes could reduce costs, improve access, and promote more equitable health outcomes. In conclusion, while Ghana and the United States differ significantly in resources, Ghana emphasizes on universal coverage and primary care offer valuable lessons. Adapting these principles within the U.S. healthcare system could help reduce healthcare spending whilst improving population health and health equity.